So this is a longitudinal ultrasound of female pelvis, unmarried, age 22 years, and what we are seeing is, now this is the length of the uterus. Bladder is adequately filled, and the uterus measures 9.3.5, a little bit increase in size for a nulliparous uterus. Now this is an adequate filled urinary bladder. Why? Because you see that the fundal, it reaches the fundus of the uterus. So ideally, when you are scanning a gynae patient, the urinary bladder should be adequately filled, the definition being that it should be at the level of the uterine fundus. This is the endometrial canal, and the endometrial canal measures 16.9 millimeters. Normal should not exceed more than 14. Endometrial canal is dilated, and you can see that the endometrial canal is filled with different strength internal echoes. Let's concentrate on the endometrial canal. Later we will see the other findings. Here you see. Let me magnify it for a better view. Now you see that this is the endometrial canal in longitudinal section. Again, measures. Here it measures 19.2 and is almost completely occupied by different strength internal echoes. This is the lower uterine segment. This is the cervix of the uterus. Now the other finding is that when I rotate the probe for the transverse image of the uterus, again now you see that this is the transverse section of the uterus, and this is the endometrial canal. It measures 19.7 millimeters, and it's full of internal echoes. No calcification is though seen, and the patient is unmarried. Here if you see now in the region of the right adnexa with iliac vessels adjacent, we see a mixed echo, complex mass, cystic mass. So you see these are the iliac vessels, this is the part of the uterus, and this is a thick walled cyst in the region of the right adnexa, measuring approximately 6.1 by 6.6 centimeter. Now this is the wall is thick up to 5.7 centimeter, and there are islands of echogenic areas. These are the echogenic areas within it, and there are fluid components also. This is fluid component, this is fluid component. These are all fluid components. So this is a complex cystic mass or complicated cystic mass of the uterus. This is the urinary bladder. This is the urinary bladder. This is the cyst in the region of the right adnexa. Small amount of fluid is seen in the pelvic cavity. This is the fluid. Small amount of fluid, and you can see echoes within it in the pelvic cavity. Do we see posterior wall acoustic enhancement from this cystic complex cystic mass? Yes. Here you can see that the posterior wall, this posterior wall enhancement is seen. So it's predominantly cystic with the abundant echogenic material within it. Is there any calcification within it? No, don't see any calcification. And another criteria of this is that it fulfills is that when I give a sweep to the probe, 180 degree, it does not change its shape. Now this is a 180 degree sweep, it does not change its shape. And you can see there are septals. Also, this is a septa, this is a septa, this is a septa. So this is a case of a right adnexal complicated cystic mass with internal, predominantly cystic with echogenic areas and with small amount of fluid in the pelvic cavity. This is a small amount of fluid within the pelvic cavity, and this is sonographically consistent with either. Now we can give you only the differentials. Then in differentials, this is either of infective origin or granulomatous tuberculous. From granulomatous I mean tuberculous, or endometrioma is the other possible diagnosis in her case. But the reason for dilated endometrial canal is unexplainable in an unmarried female. 19 mm dilated endometrial canal with because it's can be a bleed or a small polyp. Well, there is no history of menstrual abnormality as per the patient saying. बस बेटा 2 मिनट से Now this is one another thing to be noted is that there is a cystic area, hypoechoic area rather, seen at the uterine fundal region. And what is this? Now this is the uterus in longitudinal section. Uterus, anterior myometrium, the endometrial canal, the cervix, and this hypoechoic area at the region of the fundus. Is suggestive of either a fibroid, myoma uterus, or and without any other investigative procedures, it's difficult to enlarge on the differentials. Thank you very much.